I spoke with Aged Care Minister Anika Wells a short time ago, began by asking if there's a crisis in aged care with COVID at the moment.
Aged care has been in crisis for years. I don't think we ever emerged out of it, certainly not under the previous government, who neglected the Royal Commission recommendations and didn't prepare us adequately for the last two winters. Coming up into the run-up for this winter, I have been trying to catch up to the flight mid-air. I had a summit with the Chief Medical Officer, the Deputy, the regulator last week to work out, every idea on the table, no stone unturned. What can we do? And from that, we put together the winter plan, which I launched last week and is guiding facilities like this one. I'm here at the Bernard Chen Nursing Centre in Burwood through the coming winter.
Right, so when you talk about that winter plan and you're getting advice from health authorities, what are you going to do the previous government wasn't doing?
Well, we do have the benefit of treatments that were not available last time. So not only are vaccinations abundant, and we need to make sure that every aged care resident has had access to a fourth winter dose. One of the first things I did was write to providers to try and drive up those vax rates, and they've gone up 15% on my watch. The second thing is antiviral treatments, which weren't available last winter and are essential to protecting our most vulnerable from the worst effects of COVID.
Right, so the big breakthrough that a lot of people are talking about, antivirals to obviously reduce severity of cases, but as you say, that wasn't available before. So in terms of how this is being managed compared to last time, are you saying the government actually wasn't doing that much wrong in January, for example?
I can re-prosecute the neglect of the previous government if you'd like. I suspect you won't have too much appetite for that. But remember that we didn't have adequate PPE in facilities last time. People were sharing gloves, like horrific stories like that. We had massive staff shortages. We still have staff shortages because aged care workers have been working for years in almost a war zone environment with no pay rise, with huge shortages covering multiple shifts. Those problems are endemic, so I need to fix them by proper legislative reform, which is why I'm bringing legislation to the first parliamentary fortnight to start that reform process. It's also why one of the first things we did as a government was Right to Fair Work, to ask for permission to put a submission in to get a pay rise for aged care workers. Those are the sort of more long-term important reforms that will stop this happening in years to come. But alongside that, I have to do everything I can to make sure that we all ride out this winter wave that's coming and protect people from the worst effects. And the best thing we can do on that front in the aged care sphere is vaccinations and antiviral treatments.
And so you mentioned PPE. There's been concern raised by the Queensland President of the AMA around, again, this issue of PPE and availability. What's changed since you've taken charge?
That PPE is all now pre-deployed across facilities, and 1.9 million RAT kits are going out to aged care facilities each week from the federal government to make sure that none of those shortages that happened in previous winters that made life so very, very difficult happen again. They are all pre-deployed and waiting.
Okay. Workforce numbers are a big concern, obviously, and the 7-day isolation period has meant a lot of workers are not able to go into these homes. Given workers are coming in full PPE, is there a case to at least look at whether or not they need the full 7 days, that it might be pretty low risk to come back a bit earlier and alleviate the workforce shortage?
Look, I know that's what Premier Perrottet has put on the table. It's not something that has come to me for consideration. The Prime Minister has said, from our perspective as the federal government, we take the medical advice, and the medical advice at present is that it's not necessary to shorten those days from 7 to 5.
But have you sought specific medical advice on people in that situation that are wearing full PPE to have a shorter isolation period?
It's not something that, like I said, we had a summit with the Chief Medical Officer, the Deputy Chief Medical Officer, the nursing advocate, a number of people in the room last Monday, where I said, tell me, as the Aged Care Minister, what are all the things that I can do? And that wasn't something that came up.
Okay, they didn't raise it, and you don't see it as relevant to raise?
They didn't raise it. It hasn't come to me for a decision. The Prime Minister who attended National Cabinet on Saturday, as you'll know, says that for now it's a watching brief, but it's not something we need to move to. It's not the advice.
Okay, but I mean, the Prime Minister was talking very generally, though. I mean, this has been something that has been raised by one of the providers, or one of the umbrella groups of providers, that this could really help them. Isn't it worth pursuing?
Oh, they haven't raised it with me, but I guess probably the difficulty around that is that states have different mandate requirements. So what our powers are to regulate federally is slightly different to what states have capacity to regulate by way of providers' entry requirements, etc., on a state-by-state basis.
Okay. ADF personnel, the figures we have is that the number of personnel in homes has actually dropped right down to 15. This includes, obviously, health workers and nurses. Why has that got so low, and is the number of ADF personnel going to ramp back up?
So, I mean, let's remember that the ADF coming into aged care was an extreme measure taken in desperation by the previous government, because they had neglected aged care to the point that such extreme measures were required. That's not what we should be aiming for. That should not be the first thing that we reach for when dealing with crises in aged care. The difference now compared to then is that from Omicron, when the ADF entered aged care, the Department of Health started building a surge workforce, and it is now that surge workforce that we are drawing upon to address staff shortages in the industry. For example, the surge workforce filled 1,900 shifts just last week. So I think, as the Aged Care Minister, we need to focus on making sure that surge workforce is as resilient and responsive as possible. The ADF comes across the top of that and responds to supply and demand, but I don't think that's something that we should be relying upon. We need to fix the systemic problems of workforce in aged care. So again, I'm trying to balance what we need to skate through winter. That is a watching brief from us. I'm talking to the Defence Minister constantly about what's required, but ultimately what we need to do is fix workforce issues in aged care.
Okay, and that's the longer term, but what you're essentially saying there is the surge workforce is still there, and is there in enough numbers so the ADF is not needed?
And
so for now, that surge workforce, how many, what's the capacity?
The ADF is there as well, but the surge workforce, we can still build in response to demand, and I think that's something we're looking at. We're looking at all options, Tom. All options are on the table. The ADF is still in aged care, and they were ramping down on the basis of the plan before this winter wave resurged. I mean, we're all working on advice that has come in the past couple of weeks that we weren't talking about a month ago. That's the nature of COVID. So it's important that the surge workforce is there constantly to deal with the shift shortages. 1,900 shifts a week is a significant amount that the surge workforce has covered. The ADF is still a presence, but I think as much as possible we need to look at a surge workforce of personal carers and clinical nurses looking after aged care, and not our ADF. We need our ADF elsewhere.
Okay. Minister, thanks for your time today.
It's a pleasure, Tom.